Long way.
Well, let's ask one. We're joined now by Republican Dan Lungren of California. And Congressman Lungren, the idea that we've heard from David Frum and others is that that the Republican Party essentially became beholden to the right, and it became impossible to try to cut some sort of deal and find the sort of middle ground. Your reaction to that argument from conservatives?
Well, that's a hard argument to accept when we offered 80 different amendments in the Rules Committee as of yesterday, and not a single one was allowed to be brought to the floor. That's indicative of the failure of the majority to take seriously our ideas. It's not that we don't have ideas. We've had them. We've been shut out from having them considered. And you know, this stuff about we're not concerned about the little person or the people who don't have health care is just nonsense. I mean, I've been involved in this since I was a little kid and used to follow my father around on rounds and go with him when he made house calls. I spent a number of years when I was in private practice as a young attorney doing medical malpractice cases, defending doctors in hospitals with a few plaintiffs thrown in. I've seen that side of it. I've been involved in these issues for a long time. The question isn't are you for or against this bill as an indication of whether you're for or against making changes in the current health care situation. It's whether you think this is the right way to go, or are there other alternatives. We happen to think other alternatives make a far more sense and will actually build on what's good in our system rather than destroy what's good in our system. That's not being callous. That's being somewhat intelligent and somewhat sensitive to the true needs of the American people.
Well, Congressman, I think the question begs, when the Republicans had the White House, the House, and the Senate, why didn't you do something about it?
Well, we did a few things then, if you'll recall. We did create some incentives, that is, federal funds that went to states that established high-risk pools. I wish we would have done more on that. We tried to get reform in the area of torts, medical liability. We were able to get it out of the House. We couldn't get it through the Senate. We started health
So you
savings
had the majorities in the White House, and you didn't get it done. The fact is, during Republican reign, we saw insurance premiums double. We saw insurance profits double. And the American people seem to have lost confidence that the Republicans were going to do anything about this other than set up medical savings accounts.
Well, I would say this. There's no indication the American people rejected Republicans because of the health care issue. That wasn't the issue. It was because we lost our way on spending primarily. We were fiscally irresponsible. This bill is a model of fiscal irresponsibility. It doesn't pay for itself. It puts us in greater debt. And basically, it puts into question the viability the Medicare system and the Medicaid system as they exist. So, look, I say we didn't do enough. I wanted us to do even more. But the fact of the matter is, this is not bringing us in the right direction. And we have, for the last 2 years, presented front and center alternatives on all of these issues. They haven't been seriously considered.
But Congressman, speaking of being serious, I mean, you have seriously challenged the Congressional Budget Office when you say that this is going to cost money. The Congressional Budget Office says it's going to save over $1 trillion over the first decade. Are you saying that the Congressional Budget Office, which Republicans and Democrats like to paint as nonpartisan because it is, that they're just making stuff up?
No, I never said that. The Congressional Budget Office answers the question posed with the assumptions presented. And if you look at what they have said when we asked them, that is when Paul Ryan asked them, if you would include the doctor fix in it, and if you would consider some of the other uncertainties involved, would it be far more costly than suggested? The answer was yes. They heavily caveated what they said because of the uncertainties going forward. The other thing is, if you will look at the bill, it has 6 years of benefits and 10 years of taxes and cuts in Medicare. That's not a true view of what it's going to cost when you have the benefits outgoing at the same time you have the taxes coming in. So I'll stand by the numbers that CBO said. You just change the assumptions, which I think are closer to reality, and you see that it's going to cost more.
Congressman, this is Karen Finney. I wanted to ask a question. If it's true that seriously you wanted to try to get some things passed and there were some things that you agreed upon, why was the strategy not to come to the summit held at the White House, the bipartisan summit with the president, with, let's say, 3 or 4 things that you could agree on, that we could have had a deal on right then and there? Why continue to obstruct and oppose the president and this bill rather than use that as an opportunity to try to get some things done that you wanted?
Well, we weren't obstructing and opposing. What we're doing was presenting alternatives. Those alternatives were not accepted. Our alternative to more government on the federal level taking over was a greater amount of competition on the local and state level. Now, the president said, well, he accepted our idea about being able to purchase insurance policies across state lines, except he had a great caveat with that, and that was there would be all these federal mandates within that, and therefore you would not have the competition that we are talking about, so that you would have an opportunity to choose among a number of different plans to see the one that would best be suited for you. So it was a fundamental difference in philosophy as to how you approached it that made that impossible. It wasn't that we weren't willing to present our viewpoints, and if we truly were going to work on that, try and incorporate that, but they were going in different directions. Secondly, what we said was we probably could reach an agreement, different agreements, if we went on an incremental basis and looked at very specific parts of these things.
Congressman Lungren, this is Lawrence O'Donnell with a quick one
Yes.
on taxes, which is, about half of the expansion of coverage in the bill is paid for with tax increases. Is there any tax increase that you would be in favor of in order to expand health insurance coverage? Any tax increase on anything or any form of income tax increase you would accept?
Well, I would tell you, at this point in time, when our economy is flat on its rear end and where we have tremendous unemployment, I do not know of a single economist or economic school of thought that says that that's the way to create jobs. And so I think it's the wrong time to start dealing with it from that side. Are there other things we can look at in the future? Yes, there are. But right now, I think it is irresponsible, to say the least, with respect to the economy. The other thing is, if you look at some of the taxes that were brought forward, one of you said just before I got on that, look, we're going to go after the manufacturers. We're going to go after their profits. I thought we were having trouble with the manufacturing sector in this country, and that we were having difficulty with our manufacturing base being able to compete worldwide because our taxes are at some of the highest rates in the world, so that we're not competitive globally. We have to understand we're not in this by ourselves. We have to deal with a worldwide market whether we want to or not. So in short answer, I don't look at tax increases at this time that make any sense when you have an economy that is at least in my part of the country, in California, that's on its rear end. I mean, we've got more than 10% unemployment. My district's got 12.5% unemployment. To put taxes on small business and even large business at this point in time is not the way to create jobs. It really isn't.
Congressman Dan Lungren, Republican from California. Congressman, good of you to join us tonight. We appreciate you coming on.
Thank you very much.
You're welcome. As we continue to watch the debate on the House floor, again, we are